normalization of narratives. As we all know, sex, sexual reproductive health and rights is sort of a taboo, a sensitive topic within our community, various communities, cultural. It's just sensitive. So getting the buy-in of the community, of your audience, for these messages, making them do an action from your message is a challenge.
Cancer, diabetes, obesity, hypertension, and asthma are all examples of non-communicable diseases, and sadly, these diseases are the leading cause of death globally. But do they really affect us here in Africa? And are Africans really living with these diseases? Find out here at the African NCD Champions podcast as we share incredible stories of Africans living with non-communicable diseases. My name is Ogweno Stephen and I'll be your host. Let's roll! Right, welcome to another episode of the Africa NCD Champions podcast, where we look for and find interesting people working in the non-communicable diseases space across different aspects of health, and get to learn from them, their insights and their lessons. And today we've been joined by a digital health advocate. She'll be sharing with us her experience, her journeys, her stories, and what we could also learn from her. And without further ado, give us a quick introduction to yourself and what you do.
My name is Martha Kombe. Currently a freelance consultant on matters digital programming, digital media communication. Basically that is what I do.
I see. So let's take that apart a little bit. So where did you start from? How did you end up here? What's your story? Where is the origin? What did you study? And then how did that influence your journey to end up becoming a digital health advocate and consultant?
It all started, so we were raised with a mother who was a community health worker. So health and community activity, community strategy was always, it was introduced when we were very, very early. And to be specific, sexual reproductive health. I remember my mom at our house, there were like condoms everywhere. And it was normal to have them. Because she needed them, she needed them for the community.
Of course.
Yeah, so sexual public health, and to be specific, sexual reproductive health was a normal thing, a normal narrative within the house. So and that is one of the insights that got me into public health and community development studies.
I see. So looks like it started from way back with your mother, sort of starting up this conversation. So from there and then into public health and community, and then how do you end up becoming a digital health advocate? And then from there also we'll look at some of the work that you've worked with. But how did you now end up becoming a digital health advocate?
So I volunteered with different organizations but during my education time, undergraduate. So I realized some of the strategies, including the physical engagements, peer education, community mobilizing, community dialogues were not enough, especially when you want to reach young people. So I remember 2011, after Form 4, I had engaged with an organization that introduced me to social media, specifically Twitter.
Mm-hmm.
Yeah, my account was dormant for the 4 years. Then I realized the power of it. So that was when I started engaging online. Whatever I was doing offline, I was amplifying it online. So it came up to here. Digital strategist.
I see. Interesting. So what are some of the thematic areas in terms of different topics that you've worked in as a digital health advocate?
Topics.
Thematic areas and topics.
Thematic areas, mostly non-communicable diseases. There is tobacco control, alcohol control, and trans fats. Yeah.
Nice.
Trans fats control.
Yeah, of course, getting people to reduce their consumption of trans fats. And of all of these, which campaigns have you been in the longest, and what did those campaigns look like?
My two main longest campaigns have been tobacco control and reproductive health. Yeah, non-communicable diseases slightly is halfway, because one of the closest family members got one of the notorious non-communicable diseases, and I had to do something within my power.
I see. So take us a little bit into your work as a tobacco advocate and advocating against the use of tobacco. What were some of the challenges that you faced as an advocate working in that field, and what are some of the things that you saw that you were surprised that were happening in the tobacco advocacy space?
So for the past 8 years, I've seen shifts. That is one of the it's both a positive, it's a two-edged sword, both as positive and a negative. One of the challenges that we have because it's a movement, and we have faced has been resources, the ability to track our progress within the digital landscape as individual digital advocates. I can say the most impactful campaign that I held was Be Champ, hashtag Be Champ. It was a campaign against the novel products, including shisha. Beyond it's tobacco, but it's a
the other forms of tobacco
that are new,
that are being introduced.
Yes.
So the digital smokes, the velos, the nicotine pouches.
Yeah. So we were 10 digital advocates, and together with Kenya Tobacco Control Alliance, proposed a digital plan for this specific product to be phased out. The idea was to be banned. So 2018, for the campaign ran for 10 months, and 2018 we got our win. The Ministry of Health declared that ban. So that was one of my biggest wins, when I can say, in the digital campaigns.
So you've seen your work come from online to government to policy that affects the whole country.
Yeah.
Yeah, I mean, a lot of digital health advocates aspire to have such wins in their stories, and this sort of begs the question: what do we do, especially as other young people who are interested in joining as digital health advocates and looking forward to having the kind of impact that you've had? Because you have clearly huge followings, over 10,000 on Twitter, which is X now. You have a huge TikTok following, and you have done a lot of communication across those platforms. So what do other young people at the moment, what would be your insights or tips for how they could also use their platforms and join the bandwagon of digital health advocacy?
One tactic, and it's a one strategy, one stone, two birds strategy. Consistency. If you start today, don't expect tomorrow to yield any results. Basically, consistency. Consistency. You learn throughout, and an outcome can't be visible within either a year or two. So expect a lot of challenges. Yes, and have a support system. For example, you can have a buddy. When I tweet, you just retweet. There's sometimes we get discouraged of how our posts gets engagement, and by this I want to encourage young people. For us young people, health is not a priority, and it's a default setting, by the way. We see ourselves at the peak of our lives, and health is not a concern at the moment. So getting a buddy who can support you through your postings, whatever messaging you're posting out there, amplifying it on their audience would be really a thumbs up for you. So consistency and support.
I see. What did you say are some of the challenges that you've experienced as a digital health advocate working for the longest time?
So I'll give per the thematic areas. For the reproductive health is the narrative. Normalization of narratives. As we all know, sexual reproductive health and rights is sort of a taboo, a sensitive topic within our community, various communities, cultural. It's just sensitive. So getting the buy-in of the community, of your audience, for these messages, making them do an action from your message is a challenge. That is one narrative. So we are looking into changing the narratives, the current narratives, so that we buy in into what we want from the community, the change that we want to see from our audiences, and if possible the behavior that we want to see. In the tobacco space, I can say the tobacco industry interference, and also within the food policy aspect as well, the trans fats is also the industry interference. And the resources. The minimal researches that have been done are still gaps and bottlenecks for our interventions, because as much as we know this is the right thing, the other side, that is the opposition,
of course,
have done a lot, and I think it's few days ago we were just talking with you on some of the theories and researches that have been done with the food policy, food industries before, just to condition us into eating heavy in the morning, then less in the though it was a marketing strategy. So awareness, researches are not enough for the public health space. That's a challenge.
I see. So, closing remarks. What did you say are your, what did you advise, or what would you want the people who get to watch this or listen to this later on to know about yourself and the experience you've had as a digital health advocate? What would be your key messages that you'd want people to remember as they go out there?
Always be hungry for information, knowledge, question everything, and also put a lens of evidence-based when you're thrown in anything. For example, if there is a soda and it's written 0, I won't mention brands.
Yeah, 0 sugar.
0 sugar. Then you're just taking it because you want to cut out weight, because you want to, you don't want to exercise, but you want shortcuts. So always put a lens on asking more questions, inquiring into other researches. What am I getting into before indulging or taking products. Another one I would say is taking up space, and it's not the aggression, but take up space. For example, if you're at a space where you see people, you see injustice, and you know that this is something that needs to be spoken out on, take up space.
Yeah, don't be afraid to speak up when you need to.
Yes.
I see. And I think that brings us to a good close of this conversation today. Certainly there are other topics that we'll explore when we have this conversation again, but I think this brings us to a nice summary for this minisode. Thank you very much for coming, and we'll see you on the next one.
Thank you for having me.
All right.
Now that was incredible. Thank you for listening in. Share this with your networks and follow us on all social media at StoryLink and at NCD Champions. See you on the next one.